Hello everyone, myself Deepa Singh, working as assistant professor in Suresh Gyan Vihar University in Pharmacy department. Today we discuss about different non-renal route of drug excretion. In previous lecture, we already covered renal route of drug excretion, how renal excretion takes place, and different steps involved for renal excretion. Today we discuss about other than renal route or non-renal route of drug excretion. This is a biopharmaceutics and pharmacokinetics subject topic of 6th semester. So before starting this non-renal route of drug excretion, you should know about basic objects. In basic objects, we covered introduction of excretion of the drug. Without definition and introduction or description of the excretion of the drug, we don't know about what is excretion or how renal or non-renal excretion takes place. So you should know about complete description regarding excretion. And we already say that in previous lecture that absorption, distribution, and metabolism are interrelated topic. So before starting this excretion, you should know about all a pharmacokinetic parameter, that is ADME, absorption, distribution, metabolism, and excretion, and how this parameter is interrelated and how responsible for particular drug effect or therapeutic effect. And non-renal route of drug excretion. Different route for non-renal excretion or classification of non-renal route of drug excretion. With example and how this non-renal route of drug excretion takes place. So this is complete object of this particular topic. You should know complete pharmacokinetic parameter, including absorption, distribution, metabolism, excretion, and how it affect to show particular therapeutic effect, and renal as well as non-renal route of drug excretion, difference between these two excretion route of drug. And in this, these are the non-renal route of drug excretion or classification of non-renal route of drug excretion. This first is salivary excretion, second is pulmonary excretion, third one is salivary excretion, next fourth is mammillary excretion, and fifth one is skin and dermal excretion, and the sixth one is gastrointestinal excretion, and next is genital excretion. These are the sub part or sub type of non-renal excretion or different route of non-renal excretion. According to this classification, there are various routes which involve excretion. Not only the renal route is responsible or kidney is responsible for excretion, other than various route is also responsible for excretion of the drug or more amount of the drug excrete out through your body. So in this condition, the chances that required therapeutic action is not observed. So these are the type or classification of non-renal route of excretion. Now we discuss this one by one. First one is salivary excretion of the drug, and it is also known as enterohepatic cycling. And this is a structure of biliary system. And this you can see this is a biliary system, and one is right hepatic duct. It's a right hepatic duct, and it's a liver, which this biliary excretion is responsible for excretion. Next is gallbladder. Next is excretic duct is this, and the common bile duct is just below to this right hepatic duct, and duodenum is this part, and pancreatic duct is just below or just near to common bile duct, and common hepatic duct is also continuing from here, and pancreas, it's a stomach, and left hepatic duct, it's a right and it's a left hepatic duct. And according to this biliary excretion, there may be chances that some amount of drug excreted out through this biliary route or biliary system. Due to this biliary excretion rate, drug may be show less effect because drug excreted out in biliary route or biliary excretion mechanism. In biliary excretion, bile juice is secreted by hepatic cells of the liver. Means you know that where the bile juice is secreted and what is bile juice. So we can say that bile juice is secreted by hepatic cell of the liver, or main hepatic secretion of bile juice is the liver. And the flow is steady, 0.5 to 1 ml per minute. Means the bile juice flow is very less, or you can say that the bile juice is flow in approximately 0.5 to 1 ml per minute in a rate. And it's important in digestion and absorption of the fat. Without this juice, absorption and digestion is don't takes place. So this bile excretion is also responsible for digestion and absorption of the fat or fatty drugs. Approximately 90% of bile acid is absorbed from intestine and transported back to the liver for secretion. Means when it can digest it or absorb it from the bile, and it again reabsorbed, means it's ready to reabsorb or remaining drug get reabsorbed from intestine, and transport back to liver. After intestine, it again back to liver, and for re-secretion, means reabsorption is also possible in bile secretion or bile excretion. After this reabsorption, there may be chances that drug again re-secrete from intestine to liver. And in this compound excreted by this route are sodium, potassium, glucose, bilirubin, glycosides, sucrose, inulin, mucoprotein, etc. are the example. Means mainly certain compounds or certain drug which having a sodium, potassium, glucose, bilirubin, glucuride, sucrose, these type of molecule mainly excreted out by biliary excretion or by this bile route. And next is greater the polarity between the excretion. Polarity is also observed more in this excretion route, and metabolites are more excreted in bile than parent drug due to increased polarity. The metabolites are also more observed in bile excretion, and more amount of metabolite are excreted in bile route compared to parent drug or due to increased polarity of that particular drug. So bile excretion also observed that more metabolites are excreted out while than the parent drug, and increased polarity is also observed. Next is nature of biotransformation process. In nature of biotransformation process, phase 2 reaction mainly glucuronidation and conjugation with glutathione result in metabolites with increased tendency for biliary excretion. Means this biliary excretion or biotransformation is takes place by the phase 2 reaction, and the phase 2 reaction in this mainly glucuronidation and conjugation is responsible. And in this glucuronidation and conjugation, glutathione is formed, and this glutathione results of metabolites of increased tendency, or those having a more tendency for biliary excretion are observed. And drug excreted in a bile are like chromophenol, morphine, endomethacin, glutathione conjugate, a large molecular weight, and so not observed in the urine. Means those molecules who have a more molecular weight or large in size are passes by this process or by this mechanism, because those molecules have a larger molecular size or molecular weight. And we check this molecule or example of drug in this class like chloramphenicol, morphine, endomethacin are mainly involved for transformation of this process or involving glutathione conjugation. For a drug to excreted in bile must have a polar group like COH, SO3H. Means polar nature drug is also excreted out by this bile route, and can see the polar group nature drug is like COH and SO3H are mainly involved for this excretion of the drug. Next is clopidogrel and citrate. Evolution inducer is completely removed from the body by this biliary excretion. Means clomiphene, citrate, and evolution inducer type of the drug is also completely removed or completely excreted out by this route or bile excretion route. Those drugs who have a nature of evolution inducer or maybe chlorophene citrate type of drug is also excreted out by this bile route. Next in this, the endohepatic circulation for this bile excretion. In endohepatic circulation, some drugs which are excreted as glutamides or glutathione conjugate are hydrolyzed by intestine bacterial enzyme to the parent drug, which are reabsorbed. Hence, those drugs who are excreted out by the procedure or mechanism of glucuronides or glutathione conjugation form, and which are hydrolyzed by intestine or bacterial enzyme are the parent drug or reabsorbed drug. And the reabsorbed drug are again carried out to the liver for resecretion. These reabsorbed drugs are again ready to reabsorb or again show the effect of particular reabsorption site, and carry the liver for resecretion by bile into the intestine. And the phenomenon of a drug cycling between the intestine and liver is called as enterohepatic circulation. Means in simple way, enterohepatic circulation is just a process. In this, your drug or gas show cycling process or show reversible process, and the drug goes from intestine to liver, and this process is known as enterohepatic circulation. It's a systemic circulation, and drug is entered to liver, and after liver, it carrier mediated transport observed or active transport process is observed, and it goes to a small intestine. It's a small intestine, and this mainly due to the bile secretion or due to bile juice. And then again it goes to another part, that is liver part, and in liver part hepatic portal system is optional or hepatic circulation is observed. Next is the enterohepatic circulation. In this, enterohepatic circulation is important in the conversion of vitamins, folic acid, and hormones. In these folic acid and hormone type molecule, and the process result in prolongation of half-life of the drug. More half-life if observed in enterohepatic circulation or by the bile excretion. So prolonged half-life of the drug like DTP and carboxylone are observed for long prolongation half-life. Some drug undergoes enterohepatic circulation are cardiac glycoside. Examples of some another drug is also like cardiac glycoside, rifampicin, and chloropromazine is also observed by this mechanism or by this route. And the principle of absorption onto the resin in GIT is used to treat the pesticide poisoning by prolonging fecal excretion. Means certain another example of drug is like vitamins, hormones, and folic acid are also responsible for excretion of through bile route or bile side. And when it excreted of bile side, it's show more prolongation half-life or more half-life is observed of some drugs like DDD and carboxylene. And some another drug like cardiac glycoside, rifampicin, and chloropromazine is mainly observed. And the principle of adsorption onto the resin in GIT is used to treat pesticide poisoning by promoting fecal excretion. In this, more fecal excretion is observed of pesticide type like example absorption is observing the resin in GIT. So you can also treat certain pesticide poisoning or certain poisoning taken by a person, or maybe it's a pesticide. So it can be excreted out by fecal route or by this excretion or promote this fecal excretion. This is a hepatic enterohepatic circulation, how it takes place. In enterohepatic circulation, you can see that a drug in the blood, it's a drug and which is present in your blood. And after this, it goes in conjugative in liver or showing conjugate reaction in liver, and here's maybe chances that it can metabolize and maybe excrete out by renal. If it's not excreted out by renal, then it excreted by this enterohepatic circulation by this bile route. So drug in blood present and it can metabolize. When it can metabolize, it's conjugate in the liver or maybe excrete out by renal route, then conjugate in bile. Again, it present in vial or conjugate form in vial, and then this is dumped from gallbladder and conjugate in intestine. After vial, it reaches to intestine. In intestine, there may be chances that excretion in factosis takes place. So in this, after vial, it goes in intestine, and where the excretion is also possible in feces. And next is a drug in intestine. After intestine, or conjugate reaction in intestine, drug is reaches in your intestine as enzymatic breakdown of molecule or drug takes place or conjugation is observed, and there may be chances that after intestine, when drug is again reaches in your blood, then absorption takes place. It's maybe reabsorption or absorption process when drug is reaches in your blood after through intestine into blood. So it's a circulation procedure of enterohepatic procedure. Enterohepatic circulation is drug in your blood, then it goes in a liver, then in a bile. After bile, it in an intestine, then again in intestine, or maybe it again goes in a blood. Activity process for this excretion is the capacity limited or saturable process. Means limited amount of drug excreted out, and it's a saturable process. Example is like neomycin, erythromycin, amphotericin, D-tuberculin, vacurulin, corticosteroids, imipramine, and chlorpromazine. These are the examples which excreted out by this route. In this majorly, you can see that more antibiotics or some steroids drugs are present which are excreted out by this route, and it's an active process. Next factor affecting secretion of a drug in vial route or vial excretion. In this first factor is physicochemical property of the drug. In this molecular weight means this excretion of a drug by vial route is also depend on the molecular size or molecular weight of that particular compound. In this physicochemical property is the main property. And physicochemical properties further divided in different parts. First is molecular weight, and molecular weight we can say that this is excretion from vial is depend on size. If molecular weight is less than 300 Dalton, then excretion pattern may be from urine and less than 5% in vial. Very little amount of drug is excreted out by vial. Means if your molecule is very small in size or less than at least 300 in size, so more drug are excreted out by renal route or by kidney, but there may be chances that very little or small amount or concentration of the drug is excreted out by this vial route. This concentration excretion through vial route is normally less than 5% or maybe up to 5%. And if molecular weight is more than 500 delta, in this condition, while excretion is possible, large amount just opposite to less than 300 Dalton condition, and in urine it may be also excreted out and approximately less than 5% in urine. Means it's just opposite. If molecular size of a drug is less than 300 Dalton, then in this condition your drug excreted out largely through renal route or by kidney, or only less than 5% excreted out vial. And if your drug is more than 500 Dalton, then in this condition more drug is excreted out by vial, and a less amount of drug is excreted out by urine or by renal route, that is approximately less than 5%. Next is 300 to 500 Dalton, means between this 3 to 500 Dalton, both urine and vial is possible. Concentration is also not a measurable amount. It may be less, more, or maybe equal amount in both urine and vial secretion. So in 300 to 500 condition, their concentration may be vary. This is regarding molecular weight. And next in this physicochemical properties, polarity. Polarity is directly proportional to excretion. It's more the polarity of a drug, more the excretion, and by vial route. And these metabolites are more better excreted in vial rather than parent drug because of their increased polarity. We already said that it's directly proportional to excretion. Suppose a drug have a more polarity and more metabolites. So in this condition, it's more excreted out by vial route or by vial site due to the increased polarity or more polarity. So it is directly proportional to excretion rate. And the nature of biotransformation process, metabolic reaction means which biotransformation processes takes place or which are responsible for this. And metabolic reaction, in this increased polarity, increased molecular weight is also responsible. Favor viral excretion of a metabolite, means suppose your drug is having a more polarity or increased polarity, and molecular weight is also more. In this condition, you can say that more excretion of a drug is observed in vial route compared to renal route. So if your drug is more molecular weights, we already say that if it's more than 500 Dalton or more polar or more polarity of a drug, then in this condition more excretion is observed in biliary metabolites by biliary routes. And other factor of this biliary excretion is like efficacy of a drug excretion by biliary system can be tested by agent like completely eliminated in vial. Example of sulfobromophenoxylene is used as a marker. We check also how much drug is excreted out by biliary route or biliary excretion. In this example of this class drug is sulfobromophenoxylene is example, or sulfobromethrin is a drug indicator which is used for this check, and the marker is excreted in half an hour in intestine at normal hepatic functioning, means just half an hour is sufficient to examine or sample for testing this biliary excretion. And delay in its excretion indicate hepatic biliary malfunction. Means suppose excretion rate is delay or more excretion is observed, and hepatic and biliary malfunction, in this condition more excretion is observed. And in biliary excretion, calculate by one formula, and it's a formula for biliary excretion. It's a ratio of biliary excretion rate divided by plasma drug concentration. Means you can easily calculate how much drug is excreted out or cleared through this biliary route, and it's a ratio. In this ratio, when you divide the biliary excretion rate, means how much drug is excreted out by bile route or biliary excretion site, and how much drug present in a plasma concentration. Means a total plasma concentration drug is suppose 500 mg and excreted out is 200 mg. Then you divide 200 divided by 500 mg, and the calculated amount is a biliary excretion. The ability of a liver to excrete the drug in the bile is expressed as a biliary clearance. So this clearance is known as biliary clearance, and in this Next non-renal route of excretion is pulmonary excretion. So one we already covered, biliary excretion. Biliary excretion, enterohepatic circulation. Enterohepatic circulation is responsible for this non-renal route of excretion. And which factor is responsible for this? Maybe molecular weight, polarity is mainly responsible for bile excretion. More polar or more molecular weight are excreted out bile, and it's just opposite to intestine. Sorry, not intestine, in kidney. Means if molecular are in a less polar or small in size are excreted out in a kidney or renal route. And next route is pulmonary excretion. In pulmonary excretion, gaseous or volatile substance such as general anesthetic, halothian are absorbed through lungs by simple diffusion. And pulmonary flow rate of respiration solubility of drug affects pulmonary excretion. Means gaseous type or mainly volatile of a drug substance are agent, or gaseous or volatile substance are mainly absorbed by this um, lungs route or by this pulmonary excretion route. And mainly example of this category drugs, like one example is halothian, and which passes or diffuses through the lungs. And when it passes through lungs, or in this condition, pulmonary blood flow rate or respiration of solubility of substance affect pulmonary excretion. And intact gaseous drugs are excreted but not metabolites. Completely drugs are excreted out. In this condition, maybe chances that all are excreted out but not metabolites or do not metabolize. And alcohol which have high solubility in the blood tissue excreted slowly by lungs. Those drugs or those alcohol which have high solubility or more solubility in blood as well as tissue for this pulmonary excretion site or pulmonary site. In this condition, more excretion is observed or more slowly excreted out by lungs. Means in pulmonary excretion, your drug is mainly excreted out by lungs or by maybe your pulmonary site. In this condition, the excretion of drug mainly takes place by volatile nature or gaseous type of the drug. In this example, we already discussed the halothian, and drug is excreted out slowly by through lungs, and it is also depend on the solubility of a drug in blood or in particular tissue. This is regarding pulmonary excretion. It's a diagram how pulmonary excretion takes place. It's a picture of lungs, and has alveoli present, and the section transaction of this alveoli, and there's a capillary, and in capillary oxygen is transferred or to take oxygen and remove the carbon dioxide, and with the help of this process CO2 and O2, where drug is excreted out by lungs or by this lungs route or pulmonary excretion. So this is regarding pulmonary excretion. Next is salivary excretion in non-renal route of drug excretion. The pH of saliva varies from 5.8 to 8.4. Means normal pH of saliva is normally 5.8 to 8.4 is a normal pH condition or pH range of a saliva. It can vary or may vary due to condition or your food or maybe certain disease state. And normal but the pH condition is 5.8 to 8.4 of saliva. And unionized lipid soluble drug are excreted positively. Those drugs who are unionized form or lipid soluble drug are more excreted out or show passive excretion by the salivary excretion. Hence, in this non-renal also a certain condition. In condition, you can say that unionized or lipid soluble drug are more excreted out or more positively excreted out, and the bitter aftertaste in the mouth of patient is indication of drug excreted. If you can see that bitter taste or maybe taste in the mouth is patient indicate as a bitter, then in this condition, in case say that the drug is excreted out by the salivary excretion or by through mouth. And some basic drug inhibit saliva secretion and are responsible for mouth dryness. Out of this, some basic drug or basic nature drug are also inhibit this secretion or maybe responsible to mouth dryness. When you take some drug, those are basic in nature or basic pH. In this condition, when you take this basic drug, it inhibits saliva secretion. When saliva secretion gets stopped or inhibit, in this condition, you feel mouth dryness or more dryness is observed in your mouth. And compound excreted in saliva is like caffeine, phenytoin, and theophylline. In this also there's a limited drug is excreted out by saliva or by this non-renal route of excretion. In salivary route, mainly drugs like caffeine, phenytoin, and theophylline are excreted out by the salivary excretion. It's the diagram of salivary excretion. Salivary excretion in the sublingual gland is, and submedullary gland is this, and panoid gland is this. And due to the salivary secretion or due to saliva present in mouth, some drugs are excreted out by this salivary excretion or saliva secretion. An example of the salivary excretion is mainly caffeine and phenytoin type of the drug is excreted out through saliva. A basic drug, then maybe chances that your drug get dry or feeling dryness in your mouth due to presence in. This is regarding the salivary excretion of the drug or non-renal route of the drug excretion in saliva or by the saliva route. And in this next non-renal route is mammillary secretion. Mammillary secretion is another non-renal route of excretion or non-renal type of excretion. In this, milk consists of lactic secretion, which is rich in fats and protein. Approximately 0.5 to 1 liter of milk is secreted per day in lactic mother, means those those women who are present pregnant. In this condition, the secretion takes place by this mammillary route or mammillary excretion site. In this, you can say that milk or in lactic condition or lactic secretion, milk is contain more fats and proteins. And in this, fats and protein is approximately 0.5 to 1 liter of a milk is secreted per day by this lactic mother. And excretion of a drug in milk is important as a gain entrant breastfeeding infants. And pH of a milk varies from 6.4 to 7.6. Free and ionized and lipid soluble drug diffuse positively, means during this lactation or during lactating mother, there may be chances that drug excreted out by this secretion or during breastfeeding in infants, and there may be chances that taste or pH of the milk is may vary or change due to this mammillary excretion of a drug. And normal milk pH may vary approximate 6.2 to 7.6 in the mammillary excretion rate, and this is due to maybe more fat and protein present in milk or lactating mother, and the drug is maybe excreted out by this mammillary route or through this lactic or feeding during the breastfeeding. And in this, you can say also that the specific drug you are more excreted out by this route. Free, unionized, and lipid soluble drug are diffused positively, means those drugs who are unionized form or lipid soluble in drug show more excretion, pulmonary excretion, or diffuse easily through this pulmonary excretion site. Next is highly plasma bound drug like diazepam. Those drugs who are more easily bound with plasma or have a high binding capacity with plasma are excreted out by this pulmonary excretion. Example of this highly bound drug in plasma is like diazepam. It's less secreted in milk. And in this sense, milk contain protein, drug excreted can bind to it. Due to the secretion of protein or any other vitamins, drug is excreted out of wine with this milk. In mammillary excretion, amount of drug excreted in milk is less than 1%. Means very little amount of drug is excreted out by mammillary excretion. This is approximately 1% is sufficient, or maybe approximately 1% drug is excreted out with mammillary secretion. And friction consumed by infant is too less to produce toxic effect. And some important drug like barbiturate morphine may improve toxicity, means when drug is excreted out by this mammillary excretion, it's not toxic or don't show any more side effect because the excretion rate is very less. It's approximately less than 1% or maybe up to 1%, but not more than 1%. Due to this, less toxicity is observed in infants or no toxicity is observed in infants. But some drugs which are maybe toxic while excreted out this mammillary route and show more toxic effect in infants. And in toxic or potent drug category, mainly we include example like barbiturates and morphine type of the drug show more toxicity when we excrete out mammillary excretion. Next, if adverse effect of this excretion or mammillary excretion, in this decoloration of a teeth is mainly observed. Tetracycline, jaundice due to interaction of bilirubin with sulfonamides. Nicotine is secreted in the milk mother who smoke. Means when you take some drug and it is excreted out by mammillary excretion, and in this condition several adverse effect or side effects is also observed. And in adverse effect, first adverse effect is decoloration of the teeth is observed, or changes of the color of the teeth is observed. It may be yellowish or any other color, and this is decoloration of the teeth is majorly observed due to tetracycline. Next is jaundice. Jaundice is also maybe observed in some patient in this condition when some drug are get interacted. And interaction of drug is one example, like bilirubin interacted with sulfonamide. And this type of interaction takes place in this condition. Jaundice may be observed in some patient. Next is nicotine is secreted in the milk of mother who smoke. If a mother is smoking and he is breastfeeding to infant in this condition due to smoking or due to the presence of nicotine, and excretion nicotine is excreted out in the milk or mother of the milk who smoke. And it's an example of mammillary excretion or diagram of this mammillary excretion, where the excretion takes place during breastfeeding to infants. This is a table in which drug and effect during mammillary excretion, how some drugs affect mammillary excretion. And in this drug is first is chloramphenicol, and chloramphenicol affects the bone marrow and its excretion it takes place by this mammillary excretion. Then bone marrow depression is observed. Next is diazepam. In diazepam, drug may be accumulate in sedation or maybe show accumulation in sedation effect. Next is heroin. In this prolonged neonatal dependence effect is observed. Next is methadone. In methadone, possible withdrawal symptoms if breastfeeding is stopped suddenly. In methadone, mainly you can say that symptoms of breastfeeding is mainly observed when you taking methadone, and when you taking the methadone, the breastfeeding is stopped suddenly, and no lactation is takes place in mammillary excretion in breastfeeding due to this methadone. Next is proper thiouracil. In the suppression of thyroid function, thyroid is not properly worked and it may be suppressed, and suppression of thyroid. Next is skin secretion. This is another route of excretion to non-renal route. And skin secretion excretion drug is excreted out through urine by sweat and follow pH partition hypothesis. Name itself say that the excretion takes place by skin or by the sweat. And when it takes place, it should be pH partition hypothesis, and the drug is majorly excreted out by sweating or by sweat gland through the skin. And excretion of a drug through skin may lead to urticaria and dermatitis. These are the two conditions which is observed in the skin when excretion of a drug takes place by a skin route. And this is a true skin maybe condition or problem. And compounds like benzoic acid, salicylic acid, alcohol, and heavy metal like lead, mercury, and arsenic are excreted and sweat. Means some compounds or some drug which having a more strong or more molecular weight are excreted on the skin. These compounds of like a benzoic acid type of the drug, or maybe salicylic acid drug, or alcohol or conditional classes of alcohol, or heavy metals. In this heavy metals like lead, mercury, and arsenic are majorly excreted out in this skin excretion or by sweat gland or with the help of sweat. It's an example of skin excretion by or by sweat, and how excretion takes place by the skin route, and sweating is responsible for excretion. Next is gastrointestinal excretion. In this, excretion of a drug through GIT usually occur after parenteral administration. Means excretion of a drug in gastrointestinal excretion takes place. This is another type of non-route of excretion. In this route, excretion of the drug is also takes place, and in this gastrointestinal or GIT, excretion of the drug is usually occur after parenteral administration or when you take the drug by parenteral route. and water soluble or ionized from weakly acidic and basic drug are excluded in GIT. Means those drugs who are water soluble in nature or ionized in form or weakly acidic or basic in nature are mainly excluded down GIT excretion or gastrointestinal excretion. Means it's also drug dependent or type of the drug dependent excretion. In this majorly water soluble or ionized drug or weakly acidic or basic drug are mainly excreted out at this GIT excretion route, and those drug excreted out by this GIT route is like parenteral administration drug or parenterally administered drug. And in this example of drug, it's like nicotine and quinine are excreted out in the stomach. Means example of this class drug is majorly you can say that nicotine or quinine type of the drug is excreted out by this GIT or by the stomach, and drug excreted in GIT are reabsorbed into systemic circulation. Means after excretion there may be chances that your drug can reabsorb or maybe again goes in your systemic circulation, and when it goes in the systemic circulation then there may be chances that your drug can reabsorb your particular site and undergo recycling. Recycling is also observed, and in simple way you can say that this gastrointestinal excretion or GIT excretion mainly takes place for limited drug or those drugs who are water soluble or ionized in nature or maybe weakly acidic or basic in nature excreted by this GIT or by stomach. And when we see the example of this class is majorly example of drug is like nicotine and quinine are being excreted out by this GIT route, and these excretion takes place when you give the drug or administer a drug by parenteral route only, and there may be chances that in GIT route or by this stomach route reabsorption takes place. Maybe your drug is not completely excreted out and it again goes in your blood circulation. Afterward it goes in your blood circulation, it again show absorption, and this is known as reabsorption. Means there may be chances that your drug can reabsorb or again goes in your circulation or blood circulation, and these cycling processes continue for a particular period of a time. And the next is the diagram of gastrointestinal excretion or fecal elimination. This is a diagram where the small intestine, large intestine, and stomach is responsible, and drug is eliminated by fecal or by fecal route. This is an example of GIT excretion or fecal elimination. In this example of a drug is like nicotine, quinine, magnesium sulfate, streptomycin, neomycin, bacitracin, cholestrapamine, erythromycin, and chlorpromazine are the example. Or in this, you can say that these are the majorly excretion of the drug or excreted drug which by this GIT route or excretion takes place by the stomach route, and these are mainly some antibiotic or antifungal type of the drug. This is a mechanism according to different non-renal route of excretion where it takes place, and according to this mechanism and which drug is excreted out in this excretion route, urine, bile, and lungs. In this mechanism, first is glomerular filtration ATS, ATR, and PTR. In this free hydrophilic unchanged drug or metabolites of molecular weight less than 500 drug is excreted out. And second one is active secretion. In active secretion, you can say that hydrophilic unchanged drug or metabolites conjugate of molecular weight more than 500 Dalton is takes place. It's just opposite to previous, and previous one less than 500 Dalton, but in this more than 500 Dalton. Other than this, it's a hydrophilic in nature, but it's also an hydrophilic in nature, unchanged drug, and it's also unchanged drug in metabolites. Next is passive diffusion. In passive diffusion, gaseous, volatile, and blood tissue insoluble drug is mainly responsible for showing this passive diffusion process or passive diffusion mechanism. And in this passive diffusion, mainly you can say that drug those who have volatile nature or gaseous in nature. Next is passive diffusion. In passive diffusion, a free unionized or lipophilic drug or some polar drug is also show this passive diffusion. Rather than this gaseous volatile nature of the drug, some free drug or who's an unionized or lipophilic in nature also show this polar passive diffusion. And next is active transport. In active transport, free ionized lipophilic drug is takes place. And passive diffusion and some basic drug or ionized lipophilic drug is also show this excretion or passive diffusion. And in next passive diffusion, water soluble ionized drug is responsible for showing this passive diffusion. So this is a mechanism which drug is show or follow which mechanism, maybe active process or passive process, according to the nature of the drug. After this complete introduction or complete information regarding the non-renal route of excretion, you should know about this outcome, description of excretion of the drug, how excretion takes place or what is excretion, and different excretion of the drug like renal or non-renal route of excretion, and different non-renal route of excretion, classification of these non-renal route with example which drug is excreted out by that particular route or that particular non-renal route. All this you know about this topic, and how it takes place by non-renal route. So this is regarding the outcome or learning outcome. After this reference, these are some books which having this particular topic or non-renal excretion of the drug. All books are good. You can use any single book or maybe in a combination for good content. And in reference part, first reference is H.L. Sharma, K.K. Sharma, Pharmacokinetic Sharma, and from Sharma's Principle of Pharmacology, third edition, Hyderabad, Paris Medical Publisher, 2017, page number is 48 to 50. Next is D.M. Brahmankar and Sunil B. Jaiswal, Excretion of a Drug by Pharmaceutics and Pharmacokinetic, Atrazi, first edition, Delhi, Valla Prakashan, 2008. Page number is 178 to 203. And third reference is M. Das, S.K. Datta, Excretion of a Drug, Pharmacological and Therapeutic, 24th edition, Calcutta, S.K. Ghosh, 1989, page number is 54 to 63. These are the reference. You can use all three books or maybe single books. All books are good. And after this reference part, there's a question part, and after completing this renal non-renal route of excretion or exclusion, you should answer this question or should know answer of this question according to your concept. And it's a very easy question which is based on this particular excretion on renal or non-renal route of drug excretion. In question part, first question is, what does pharmacokinetic include? So we already said in previous slide or in first slide, before starting this elimination, you should know about pharmacokinetic. What is pharmacokinetic? So in this, you tell about what is a pharmacokinetic or pharmacokinetics include. The option is mechanism of a drug. B option is localization of a drug. C option is interaction of a substance, and D option is the extraction of the substance. Out of this ABCD option, correct, select any one correct option. And in second question, what does pharmacokinetic include? Pharmacokinetic includes, A option is a drug biotransformation in the organism. B option is influence of a drug on metabolism. Some process means how biotransformation or how drug influenced by this. And the C is influence of a drug on the genes. And D option is complication of a drug therapy, means how this complication of a drug therapy takes place. In third question, the biological half-life of a drug. A option is it is a constant physical property of a drug. What is in this third question, you should know about what is biological half-life and how it takes place and how it's responsible for excretion or effect of a drug. In this A option is a constant physical property of a drug, it's constant chemical property of the drug. It may be increased in patient with impaired renal failure. D option is maybe decrease in patient by giving the drug by rapid IV injection. And this is the four option. You select any one correct option out of this ABCD for biological half-life of the drug. Next, fourth question is the loading dose of a drug is based upon. In this, you know about what is loading dose and how you calculate this loading dose. So in this, according to loading dose, there's a four option. In A option is time taken for complete elimination, means how much time is taken or how much time is required to show the complete elimination, complete excretion. And B option is percentage of a drug excreted in unchanged in urine, how much drug is present in unchanged form or not changed form in a urine. And percentage of a drug bound in plasma protein, means how much drug is bound in plasma protein. And D is apparent volume of distribution, desired drug concentration in the plasma. Apparent volume of distribution is already covered, and how in this option we say that apparent volume of distribution, desired drug concentration in plasma is mainly discussed. And the next fifth question, the rate of diffusion of a drug across biological membrane is. A option is directly proportional to concentration gradient. B option is dependent on the route of administration, and C option is indirectly proportional to membrane area, and D is indirectly proportional to lipophilicity. In this, you know about how diffusion takes place and what is the rate of diffusion of the drug and across this biological membrane. And according to this, first option is maybe directly proportional to concentration gradient. In second option may be dependent on the route of administration, which route you use for administration of that particular drug. Next is indirectly proportional to membrane area, how the membrane area is responsible or showing the for proportional to particular area. Next is indirectly proportional to lipophilicity, means lipophilicity is also responsible for this elimination of the drugs of this biological membrane. Next, sixth question is the biological half-life of a drug. In this, A option is it is a constant physical property of a drug. B option is it's a constant chemical property of a drug. And C option is maybe increase in patient with impaired renal failure. And D option is it may be increase in patient by giving the drug by rapid IV injection. Means there's a different route or different physical or chemical property. According to this four option A, B, C, D, you select that any one correct option which is suitable for this biological half-life. Next, in seventh question, half-life does not depend on. A option is biotransformation, B option is time of absorption, drug absorption, C is the concentration of drug in plasma, and D is the rate of drug elimination. This is a four option regarding half-life. And this, according to this half-life, you select any one correct option. And in this eighth question, elimination rate constant is defined by following parameter. In this, A option is rate of absorption, B is maximum concentration of a substance in plasma, and C option is the highest single dose, and D option is a half-life. In this, you know about what is elimination rate constant and how it vary drug to drug and how it affect in particular drug. In this four option, maybe rate constant or maximum concentration of substance in plasma or highest single dose you given, or maybe half-life. And this is all regarding this four option of ABCD. Out of this four, you can select any one correct option. Next is ninth question, a rheological parameter of a blood. In this, A option is rheological parameter of blood. B is amount of drug substance obtained by orally or quality of intake. Next, C is extent of absorption, hepatic first are classified, and D is glomerular filtration rate. You can select any one correct option. Ninth, after ninth, there's 10th question. In 10th question or last question, biological barrier include all except A is a renal tubule, B is a cell membrane, C is capillary wall, and D is placenta. These are the four barrier, and we already covered this biological barrier. According to biological barrier, you should know about which biological barrier other than which is not in the biological barrier. So in this, you select any one option which is not suitable, or you can select except of this option. So you answer that one correct answer. This is all regarding the non-renal route of drug excretion. We covered both renal and non-renal route of drug excretion. So you just clear the concept regarding this pharmacokinetic parameter, not only elimination, but including absorption, distribution, metabolism, and excretion, and how it takes place. And today's topic of non-renal route of excretion. So easily. So thank you so much for watching and listening this video. Thank you.